Hello, I'd like to talk to you today about a very serious topic, and that is depression. A lot of us lose things in life, and we have to process that loss. And some of us have grief, which is a normal and natural response. And sometimes that grief develops into depression, which is a heart wound. That particular loss hurts us deeply, and we work through that process of grief, but we don't get out of it. We end up stuck in depression. So I want to talk to you today about a couple of things. One is what depression looks like, and the other one are some concrete steps you can take to help yourself or someone you care about who is dealing with depression. So, one of the things that's important to understand is that healing from grief takes time. It's very normal for us to go through a grieving process when we've suffered a loss. We may start out in denial of that loss. We may be angry about that loss. We may be angry at ourselves or someone else. We may be angry at God. There are lots of people that we may get angry at, and we may deny that it happened. We may try to pretend like the loss didn't really happen, or that that person or that thing that we lost is coming back. It could be a loved one that we've lost. It could be a job, a life situation, a home. There are many things we could lose that would move us into grieving and possibly into depression. We can also be or spend some time in hopelessness, thinking that the future will never come, that things will never get better. We can become trapped in that hopelessness and despair to the point that we spiral into depression. And it's important to understand that we don't want to deny the loss. Let's give ourselves time to work through our grief, but let's not try to go immediately to a new beginning, to a new future. It takes time to work through the grieving process, and it's important to understand and give that time to people. So there are some things that are different between grief and depression. Grief involves emptiness and loss. Depression moves into hopelessness, as if that void will never be filled, that thing will never become back. Grief comes like waves. It comes and it goes. Whereas depression is persistent anguish. You may have seen a time in a funeral home, for example, when people would be grieving the loss of a loved one, but then a few minutes later someone would remember a funny story about them and everyone would laugh. And so in that case, the grief comes and goes. Depression is always there. It's always a sense of persistent anguish. Grief is tied to memories of specific things or people, whereas depression eventually devolves into something that's not tied to a memory of a specific thing or event. You're just always depressed, even when you're not thinking about the thing. Grief can involve sometimes going into positivity and humor, whereas with depression, we're always unhappy and always miserable. In grief, we're thinking about the deceased person or the thing that we lost. We're sad or grieving when we think about that thing. But in depression, it really becomes about ourselves. We become self-critical, self-doubting, pessimistic. The depression becomes about us and not about the thing we lost. In grief, our self-esteem, the way we view ourselves, can be preserved. But in depression, we feel worthless. We have even a sense of self-loathing. So when we see someone who is depressed, their symptoms, first of all, depressed mood, sadness, emptiness, hopelessness. They may have a lack of interest or pleasure in activities. They may have significant weight loss or weight gain, sleeping problems. They may be fatigued. Our bodies get tired of carrying the load. We may have recurrent thoughts of suicide, normally without a specific plan. It's important for us to talk about this. Someone may say, I wish I had never been born, or someone may say, I wish I could just die, or someone may say, I have a plan to end this and I'm going to do it. So there are degrees of suicidality. If someone in your life, someone you love, expresses this, or if you yourself are feeling suicidal tendencies, I urge you to reach out and call the National Suicide Hotline, and I'll put the number right here so that you can call it. If you call this number at the National Suicide Hotline, someone will be able to help you work through, yourself or this other person, whether there is a risk of suicide or not. And I urge you to call that. So I want to teach you now some things that will help you to deal with depression. And these are things that we use in our practice here in Lebanon, in Syria, and Egypt, here in the Middle East. These are some things we use with people who suffered the trauma of war and life as refugees and are often caught in deep depression. And the first one we call angel wings. So in order to do angel wings, take your hands like this, turn them toward your face, palms toward your face, and cross your hands and put your hands on your arms. And just start tapping back and forth like this. The most important part of this is that you tap left and right. Flapping them like this at the same time is not effective. It needs to be a back and forth technique from side to side. You can tap harder if you want or softer. The speed can vary. It can be quick or it can be very slow. When I demonstrate it for people, I usually do it like this so that you can hear the sound of the tapping while you're tapping your arms, and it's a fairly moderate speed. Your body will know what it needs, so trust your body and feel how fast or how hard you want to do the tapping. Your body will let you know what it needs. And again, the most important thing is that it is left to right alternating. If you have trouble doing this, you can tap your legs. It's also important if you're, for example, if you're at work and you're overcome with depression, you may not want to do this in front of your fellow workers, but maybe under the table you can tap your knees left and right. Or you can even tap your feet on the ground. Pretend like you're walking left, right, like you're marching or walking on the ground, and just do that back and forth, and that will offer you some relief. That's why we like to go for a walk and think about things. Our body knows that there's some benefit to that left, right, that walking motion, and it helps us to think through things. So if you're just sitting at work, just do your feet back and forth under your desk, left, right, and that will help you with the depression that you're feeling in that moment. Also, we have words of peace. These are things that you enjoy hearing or saying to yourself that will bring you some relief. I have favorite Bible verses that I like to remember. One of those is Jesus said, "Come to me, all of you who are weary and heavy laden, and I'll give you rest." I find great comfort in those words of Jesus. You may have other things that bring you comfort, like, "Thank you, Lord. Oh, Lord, you are good," or "Heal me, Lord." Or if you're not a religious person, you may have something that brings you peace that you can say to yourself, a favorite poem or a quote from a favorite poet. Another thing that will help you when dealing with depression is something called a container. The container is a place to put distressing memories when you just can't deal with them right now. When you have something you have to do or you have to focus on, concentration is difficult for people who are suffering from depression. And so if you're at work and you need to deal with something right now, there's something important, then the container may help you. Just imagine a box, or it could be a vault, or some container that you can put a memory in. Mine is a pirate chest. The container should have a strong lock on it. No one should be able to break into it, and whatever you put into it should not be able to get out. And it should be something you have a key to. You're the only one with a key. Only you can open it and let that thing back out after you've put it in there. We don't put people in containers, but we can put attitudes of people or situations with people in a container. Those are things you can put in a container. So I want you to imagine right now something that is really weighing on your soul, and you feel like you just can't think about it right now. I want you to take that thing, and I want you to close your eyes, and I want you to imagine a chest or a vault or a lockbox that you can open it. Just see that lid opening and see yourself with your hand putting that thing in there. And then with your other hand, close the lid, and it can't get out now, and you lock it. and just put that aside. See yourself putting it aside. Now go ahead with your work, whatever you need to do. It is important to remember that this is not like a rental shed where you keep putting things and you never take anything back out. Later, when you're in a place where you can think about it, it's important for you to open that box back up, that container, take that memory out or that thing and deal with it, to think about it. But just have that container handy whenever you need to be able to put it away and not think about it for a while. There are also places of well-being that can help you. My favorite is Petra in Jordan. There's a place called Cathedral in Petra in Jordan, and I have wonderful memories of sitting there in that peaceful place with nothing to bother me and just being in solitude and peace and being able to think through things. So just imagine some place in your life. It can be a real or an imaginary place. I had a refugee child tell me they had never been to a place of peace any time in their life, but he played a video game called Minecraft, and he had created a tower in Minecraft. That was his place of peace. He could go there and relax and feel safe and feel at peace. So it can be a real place or an imagined place. It should not be linked to your trauma. So if you have a good memory of something, but it's linked to your trauma, choose another place of well-being that's not linked to whatever it is that's causing you depression. And you can just close your eyes and just imagine it around you. Imagine you're seeing this place of peace all around you. Maybe you're even hearing some sounds that are related to it, the rushing of water or the chirping of birds, some sound that's related, perhaps waves on a beach at the ocean. Let yourself hear the sounds and even smell the smells of that place. Just let it surround you, that place of well-being, so that you feel at peace there. While you're there, you can use it with the words of peace that we talked about before, or even controlled breathing. And if you want to learn about controlled breathing, look at my anxiety video. I'll go into depth about controlled breathing and why it's important. But just inhaling and exhaling in a measured way. It's also important for you to have self-care if you're dealing with depression. My self-care program is meditation. There are Bible verses I like to meditate on. I just say them over and over to myself. Prayer, daily prayer, reading from the Bible is part of my exercise, part of my program. Exercise is very important. If we're dealing with depression, our body needs to think it has some release from that thing which is bothering us. And so moving around, running, bicycling, walking, calisthenics, these are all ways that we let our body feel like it has some release from this thing that is bothering us. And also I urge you to get therapy from a provider in your community, from a clinical mental health counselor or psychologist in your community that may be able to help you in dealing with your depression. So I hope that what I've presented today has been helpful to you to know about depression and some things to do to help yourself or someone you care about who's dealing with depression. Thank you. Okay.